So I don't want to repeat a lot of what other people have said because we've got a lot of great material, but I think I'm going to talk about my maybe experience with CAPS here and how that's changed my life. When I first went to college as an undergraduate, basically the first weekend I go out to a fraternity party, and I came from a kind of a strict background, so I was never really around alcohol or guys and girls hooking up, and I see that and I had a panic attack. And I literally had to run out of the party. I didn't know what had happened. I thought I was going crazy, thought I was having a heart attack at the same time. And the result of that was I became kind of avoidant on the weekends. I would just kind of not go to those situations because I didn't know how to cope with the symptoms. And it was really kind of an enigma because there are certain situations I was fine at. I could ask professors, questions. I could give a lecture in front of a big group of people and not feel nervous at all. But yeah, I would eat most of my meals alone. But that was confusing because if I saw someone else eating their meals alone, I would always be the person who would go and introduce myself and eat with them. So I kind of had this panic and anxiety and more so some specific situations. I did great in academics. I was on the track team, so I got to meet friends that way through common interests. So eventually you made good friends. And then I coped, basically. Did okay. I didn't really deal with the problem. I was successful enough that I didn't interfere with areas of my life completely. I thought I was doing okay. Then I come off here to graduate school. And that's going fine at first as well, but then eventually I want to start dating and making friends outside my graduate program. And I found I didn't know how to do it. Because I was in those situations, even to call a guy friend that I had met, it would take like an hour holding the phone in my hand, trembling. A girl would take like 6 hours. It's natural to feel nervous. Everyone feels nervous, but that's the extreme of it. It really prevented it. So I decided to seek help. I decided to go into CAPS. And going into to see counseling, I felt, of course, I had character flaws. I felt like I was weak. I thought that something was wrong with me. Not even necessarily knowing any kind of diagnosis. That caused me, from the anxiety of all that, to actually get depressed. And one of the first things that was pointed out to me in treatment was that I just thought about everything really irrationally, all the distorted thoughts. Not only about myself, and things around me, just things like only looking at the negatives of the situation and none of the positives. When good things happen to you, often if you have mental illness, you filter them out completely and you forget that good thing even happened. And I really hit rock bottom maybe on my third session or so. My counselor wanted me to say just 5 positive qualities about me, and he gave me like 5 minutes to do it. And I couldn't do it. In those 5 minutes, I was just bawling. I think I said I'm a hard worker and I'm nice. And that was it. The good news is, of course, is things can change really, really rapidly, especially if you seek treatment, particularly if like cognitive behavioral therapy, and you really learn how to address those thinking patterns. Within just a few weeks, within 5 minutes, I could rattle off 50 great quality things about me. And it wasn't because I was in a manic phase, it was just because you learn how to think much more appropriately about yourself. And then I rolled in some of Tiffany's groups, the social confidence groups. And the great things about those types of situations is that you're with other people who are in the same situation, and then it's really powerful because when you see someone else thinking or speaking irrationally like if you do, and you see it coming from them, that's when you can really recognize too your own kind of thought processes and your own behavioral patterns. And it's really funny, you could be giving advice to someone else, and it's really the same advice that they're going to give right back to you. You don't really recognize that at first. So that was all great things that really just changed my life. I became so much more outgoing, so much more confident, started dating, having girlfriends. Tiffany will be able to tell you all about really, it was great. And the big thing about it too is when you're at the age in college, as was pointed out by Peter, that's when people are first diagnosed with mental illness. Along with it, though, that's when your family is going to be exposed to it the first time. Your friends are going to be dealing with people for the first time, so they don't necessarily know around this age how to deal with that, how to interact with you. They can be scared. They could get annoyed with you because they don't know what's going on. It's largely because they haven't had to deal with it either. They haven't had close friends go through it. So the good thing about the groups here, at least, is that you meet other people who are going through it. And then, as I found as I've gotten older, friends and family, they've witnessed other friends go through it before, and so they know how to be much more supportive. Whereas, that 18 to 24-year-old group who's never seen a friend in that situation before, they still don't necessarily know how to do it. So I think if anyone themselves, or if you have any friends who you think could use the help, do what they suggested in this skit. Talk to them, listen to them, suggest that they go see a counselor, be willing to go with them, walk them to their sit in the waiting room with them. If you know someone else who's been in that situation, just say, oh, my friend had to do this and it really changed her life, and my sister did this. Or even yourself, if it has happened. If you do those things, you can really make a difference now that your friend or your family, because for a lot of people, all it takes is, 4 to 12 times seeing someone. They can get the cognitive skills down. Medications can certainly help. Depending on the illness too, often it just takes away some of the physical symptoms, so you get to practice a lot of the cognitive skills. And then once you do all those things, you're going to have times when you relapse, perhaps. You might not as well, but you can really handle the illness and make it so it doesn't limit yourself. So thank you very much for putting this on.